Speaking of moving forward, there's now an end in sight when it comes to COVID-19 restrictions. But as KITV4's Leah Kamanah tells us, some are wondering how the state will respond should a new variant emerge. Leah.
Well, a new variant could potentially mean another surge in cases, Rick. So today, members of the legislature, the Senate Health Committee and House Committee on Pandemic and Disaster Preparedness held a hearing with county mayors and the Department of Health to discuss what their future responses will look like.
Can each of you maybe share, as much as you're willing, how you're approaching any contingency plans that you might have in place to address future surge activity, and what specifically the legislature should keep in mind?
Senate Health Chair Jarrett Keoho-Kalole posing that question to the county mayors.
You know, most of us have done and been through a number of surges and major surges. And could we have that in the future? It's always a possibility, but we've learned to be prepared.
The other mayors echoing Maui County Mayor Michael Victorino, saying hospitalization rates and health care and other emergency personnel staffing will remain key metrics. That same question then posed to the Hawaii Department of Health.
It's going to be watching case counts go up. It's going to be watching the community response to that. It's going to be things like the wastewater surveillance and seeing that trend up. It's going to be following the CDC guidance and moving from a green category to a yellow medium category.
The follow-up question is, seeing as how your administration has pretty consistently been more aggressive in response to the pandemic and more conservative in terms of loosening restrictions, are the CDC guidelines, are those viable indicators for the community in Hawaii to be monitoring should there be another surge?
The CDC guidance has 3 general categories, right, for low, medium, and high. But if you look at the medium category, there's guidance in there that says things like, you know, wear masks if you are at high risk. And it also says that we should strongly consider wearing masks if we're around others who are high risk. And if you look at our population in the state, we have really high rates of diabetes, heart disease. I think that's partly why, you know, it behooves us to be cautious. So we will be watching the CDC guidance, and we will also be looking at, you know, total case counts and again, what's going on in the rest of the community.
Dr. Libby Char and state epidemiologist Dr. Sarah Kemble also saying the type of variant that comes next will make a difference in their response.
It would be different having a new variant where, okay, we're not seeing a bunch of hospitalizations where it's emerging versus a variant where you're seeing 90% of people end up in the hospital. That would be a really different level of concern.
After the hearing, I spoke with Senator Keoho-Kalole, and he tells me the most important thing to him is to ensure there are open lines of communication to the community so that people can prepare and know what to expect if another surge were to happen. Leah Kamanah, KITV4 Island News.